Hi, I'm Dr. Mark Poray, a family and sports chiropractor in Brooklyn, Ontario. I've been in practice for over 28 years, and one of the things that has gotten a little under my skin, and I assure you under the skin of many of my colleagues, is how many family doctors still have an uninformed bias against chiropractic care. Now, considering the increasing stress being placed on family medical practices in sheer volume of patient visits, one would think that family practitioners would welcome a diversion of some of this load. Some family doctors, more so recent graduates, are becoming more receptive and knowledgeable, but many of their older colleagues are still giving their patients incorrect information and advice regarding chiropractic care. Now, considering the unprecedented financial load being placed on our healthcare system, one would expect the government to give more consideration to approaches which can divert some of this load. Furthermore, one would think that this government would pay closer attention to the results of an independent examination which they commissioned, which would effectively treat a very large portion of the population which is currently bogging down effective healthcare delivery. And I'm speaking about low back pain, or LBP. In 1993, over 20 years ago, the government commissioned Professor Pran Magna of the University of Ottawa's Health Administration program to carry out a study on low back pain. What he found was that much of the treatment of low back pain in Canada, the USA, and the UK, as well as other places, showed divergent, conflicting methods of care, which, with very high costs, little scientific evidence of effectiveness, and increasing levels of disability. So Dr. Magna found in his study that physicians, chiropractors, and physiotherapists, as well as an assortment of other health professionals, offered about 36 different types of treatments for LBP. Here's a summary of the results which focus on cost effectiveness and effectiveness of the treatments themselves. First, spinal manipulation applied by chiropractors is shown to be more effective than alternative treatments. Medical treatments are of questionable validity or are clearly inadequate. Second, there is no scientific data to show that chiropractic treatment is unsafe. Further, the literature indicates that chiropractic manipulation is safer than medical management of LBP. The literature reveals that there is a need to show the validity of medical management of low back pain. There is some evidence to indicate that spinal manipulation done by other than chiropractors is less safe and less effective. Fourth, there is an overwhelming body of evidence to show that chiropractic management of low back pain is more cost effective than medical management. Fifth, there would be highly significant cost savings if more management of low back pain was transferred from medical doctors to chiropractic doctors. There is, in fact, empirical evidence that patients are very satisfied with chiropractic management of low back pain and considerably less satisfaction with physician management. So, seventh, in spite of medical disapproval and economic disincentives to patients, that is, having to carry the cost themselves, the use of chiropractic care has grown over the years. This is the eighth point. All of the above are considered together offer an overwhelming case in favor of much greater use of chiropractic services in the management of low back pain. And ninth, the last finding, the government should instigate and monitor reform to take appropriate steps to see that these savings achieved through chiropractic management are captured. And the recommendations from the report were as follows. First, that there must be a shift in policy to encourage and prefer chiropractic services for most patients with low back pain. Second, chiropractic services should be fully insured under the OHIP system. Recently, as you know, in the last 10 years, chiropractic was removed from OHIP, and this is probably a huge error made by the government. Number 3, Chiropractic services should be fully integrated into the healthcare system, including hospitals, healthcare centers, etc. Actually, this is actually happening right now. So why your doctor may still be opposed is a big question. Are they really up to date on all the facts? Fourth, chiropractors should be employed by tertiary hospitals in Ontario, and this is also already happening in the USA. Fifth, hospital privileges should be extended to chiropractors for the purposes of treatment of their own patients who have been hospitalized for other conditions. Sixth, chiropractors should have access to all pertinent hospital records. Seventh, a very good case can be made for making chiropractors the gatekeepers for the management of low back pain in the Workmen's Compensation System, or WSIB. Eighth, the government should make more funds available for chiropractic research for further clinical management of low back pain. Ninth, chiropractic is the only regulated health profession in Ontario without public funding for education at present, and this works against the best interests of the healthcare system. 10th, the final recommendation, the government should take all reasonable steps to actively encourage cooperation between providers, meaning medical, chiropractic, and physical therapy professions. Look, I hope this quick summary of the Magna Report from 1993 gives you a little more information and that you can provide to your family doctor should they have any continuing concerns about your chiropractic care. I'm Dr. Mark Poray, and if you would like more information about my office or some of the other conditions that I treat, please scroll through the archives on the main page of my website, which is www.drporay.com. See you the next time.